Good afternoon. I'm Linda Baker, the Learning Director at the Center for Research and Education on Violence Against Women and Children. On behalf of the Knowledge Hub team, welcome to our research briefing, Building Connections, Supporting Community-Based Programs to Address Interpersonal Violence and Child Maltreatment using relational, trauma-informed frameworks. The presenters will speak for about 15 minutes. Please enter comments or questions for the presenters into slido.com and use the code 7423. That will be shown on the slides for your reference throughout the presentation. During the last 5 minutes of our research briefing, I will present some of your questions to our presenters for their response. The link to the presentation slides was emailed to you earlier this morning. Now I'm honored to introduce our speakers. You can read more about them on our website, but we want to hear from them rather than about them today, so I'll make this brief. Margaret Leslie is Director of Child and Family Services at the Canadian Mothercraft Society. For the past 35 years, her clinical experience has been in the areas of prevention and early intervention services for families and young children living in conditions of risk. She was instrumental in the development and implementation of Mothercraft's Breaking the Cycle program, a CAPC CPNP project recognized by the United Nations Office on Drugs and Crime as a best practice program serving pregnant and parenting women with substance use problems and their young children, and which partnered in the delivery of Building Connections. She led the national replication of Connections, Breaking the Cycle's trauma-informed intervention for mothers and children experiencing interpersonal violence. Dr. Mary Motts is a clinical psychologist at Mothercraft's Breaking the Cycle program in Toronto and an adjunct faculty in the Department of Psychology at York University. Since obtaining her degree in clinical developmental psychology at York University, she has been working as a clinical psychologist with infants, young children, and their mothers who are at risk for maladaptive outcomes due to issues related to maternal substance use and mental health difficulties, trauma, interpersonal violence, systemic discrimination, and poverty. With that, I'm delighted to turn our presentation over to Mary and Margaret.
Thank you, Linda. I'm going to provide an overview of the activities of the Building Connections initiative and then turn it over to Mary for the intervention research findings. Next slide. So the overall aim of Building Connections was to disseminate an interpersonal violence intervention group that enhances the capacity of service providers to identify and respond to mothers and their young children impacted by intimate partner violence and child maltreatment, and to evaluate the impact of that dissemination. The intervention was disseminated to CAPC, CPNP, and Aboriginal Head Start projects, and these community-based projects are funded by the Public Health Agency of Canada, and through their core mandates, engage and support vulnerable families living in conditions of risk that include poverty, isolation, family violence, child maltreatment, and trauma. These projects are embedded in communities across Canada and often act as an entry point where isolated families are linked to the health system and other supports in the broader community. So Building Connections was delivered through Breaking the Cycle, Mothercraft's CAPC CPNP project, where the Connections intervention was developed. This slide that we're looking at now identifies the main activities of the Building Connections initiative, which were to develop resources and deliver training on family violence and child abuse prevention to all the CAPC, CPNP, and Head Start projects. The second, to deliver intensive certified training on the delivery of connections to a subset of those projects. Then to deliver a weekly community of practice consultation group to support service providers delivering the intervention. And finally, to conduct intervention research to evaluate and share learnings. Next slide. The first activity in the first phase of the project, in that first activity, we developed a resource manual and delivered a national training webinar to all CAPC, CPNP, and Head Start projects, of which there are over 800. The webinar viewers reported overall satisfaction, as well as increases in awareness, capability, and confidence related to interpersonal violence. Next slide. To prepare for the next phase and the next activity of the initiative, we developed a readiness tool which served as part of the application for projects interested in proceeding to the next phase of the initiative, which involved intensive certified training on the intervention and then delivery of the intervention. So in selecting these sites and projects that would replicate the intervention, the Your Starting Point Story tool helped us assess readiness and ensure that the projects we selected had the capacity as well as existing practices in place to offer the intervention safely. Next slide. In the development of the training and evaluation for Head Start projects, we collaborated with research leaders and teachers in the community and developed research methodologies that offered choice to communities and input from communities. Next slide. So activity 2 of the initiative was to, in activity 2, we provided intensive certified training on the delivery of the Connections intervention to 75 facilitators from 34 community-based projects, followed by a weekly community of practice to reinforce training and delivery concepts, to promote fidelity of the intervention, and to provide a space for mutual learning. I'm just going to take a moment here to note an error on the slide. The certified training commenced in January of 2016 and was completed in June of 2019. Next slide. We evaluated the training and community of practice, and facilitators noted the importance of the relationship-based and trauma-informed approach embedded in both activities, which they were then able to take back and translate to their own agencies and projects. Next slide. The training of Head Start projects was led by Indigenous partners as well as a healer, and participants found the training to be both culturally relevant and safe. Next slide. The delivery of Connections took place in projects across Canada by the certified facilitators and represented a range of communities by population size, geography, and culture. Next slide. And then finally, the activity of evaluating the intervention. We anticipated that compared to reports collected prior to the intervention, the post-intervention measures would find that the facilitators would report being satisfied with the intervention and would observe and report positive changes in functioning and knowledge of participants, and that participants would experience improvement in their sense of self and relationships, social supports, mental health symptomatology, and parenting capacity, as well as decreased interpersonal violence. So with that, I'll turn it over to Mary to present the findings.
Thanks, Margaret. There was a very high uptake and implementation of Connections across communities, with a number of projects delivering the intervention up to 5 times. There were a few that didn't have a chance to complete their final group due to COVID-19 pandemic closures, and there were also a few communities who had been recently trained and did not have a chance to implement the group yet. But overall, we had an 80% implementation rate for communities who were trained to deliver Connections. Facilitators who delivered Connections reported that they experienced changes in their own work within communities as a result of partnering in the Building Connections initiative, including increased awareness of the impact of IPV in their communities, strengthened feelings of competence in responding to families who were struggling with IPV, enhanced collaborations with families to provide support, but also increased collaborations within their organizations and communities to support families, and a greater sense of feeling safe to do IPV work and to provide safe environments for families. Over and above the impact to their own work, Connections facilitators talked about how their ambassadorship of the Connections program promoted changes in the way that families struggling with IPV were supported by their entire organization and by other community programs as well. I've included a few quotes. If you have a chance to read them later, I think that they really punctuate the impact of Connections, but due to time, I won't read those right now. According to Head Start facilitators, integrating culture into the Connections intervention was a key component of how and why the intervention was impactful to Indigenous communities. Facilitators indicated that Indigenous culture is an integral part of healing, that women need to have a chance to address intergenerational trauma first in order to move forward, and that it was really important for Connections to be delivered by Indigenous facilitators to Indigenous women. On average, certified facilitators seemed very satisfied with the Connections community of practice, including continued support to get together, to reflect and to learn from each other, and to share resources. We also know that the community of practice was an important aspect of ensuring and maintaining the fidelity of both the intervention as well as the evaluation research. We had 383 families who were involved in the evaluation of Connections. We had initially proposed 400, but were slightly thwarted by the pandemic in reaching that goal. However, we were happy to be able to provide these results. So women were a wide range of ages that participated in Connections. Most women identified as Canadian-born, English-speaking, and having completed high school. Most women were not employed and living in poverty, and about half of the women were single parents. Women's satisfaction with Connections was measured on a weekly basis, as well as at the end of the intervention, on a scale from 0 to 4. According to women, they were highly satisfied with participating in the Connections intervention. And we felt that these were especially significant results due to the fact that all of our data collection occurred with iPads and using SurveyMonkey, so that facilitators were never at any point responsible for the administration of questionnaires and satisfaction measures. We felt that this would increase the reliability of responses, but also the safety for both facilitators and for women. There was a completion rate of Connections for families that started of 80%. There were a number of areas that were measured in questionnaires that women completed before and after participating in Connections. And very excitingly, women reported that they experienced significant changes in all of the areas that we measured in the expected directions. So there were increases in self-esteem, self-efficacy, ability to feel closeness in relationships, ability to depend on others in relationships, knowledge of community services, and understanding of IPV constructs, as well as significant decreases in anxiety in relationships and parenting stress. Even more exciting were that we had some preliminary data from women who were willing to complete the questionnaires again 1 to 3 months after participating in the group, so that we could start to identify some trends of longer-term impacts of Connections. The patterns of improvement were largely consistent over time. An example is here. This is the parenting stress index score. And as you can see, there is a significant decrease between before participating Connections and after, as well as a continued decrease months later. We also looked at the results across geographic regions and by population center. So here is one example related to women's reports of self-esteem before and after they participated in Connections. And those results are parsed out based on geographic region. So there is West, East, and Central. And as you can see, there's increases in all of those areas. And the results were similar, the variations and patterns across the areas measured, so that there were improvements noted everywhere. One might surmise that the intervention was delivered with fidelity, and it was equally impactful and effective regardless of where it was implemented. Many women provided comments and qualitative responses in interviews about their experience in connections. These themes provided a sense of the areas that women themselves identified as critical learnings from connections, also in areas where they identified direct impacts to their thoughts and their behaviors from participating in connections. So as you can see here, women were identifying changes related to their sense of self, to their interpersonal relationships, in their parenting, and they also identified what were the important supports that they received while participating in connections. So supports from other women in the group, supports from the connections facilitators. And really interestingly was the way that they spoke about the importance of the fact that connections was delivered in their CAPC, CPNP, and Head Start projects. Women talked about that having an IPV group in their community-based project made them feel safe and comfortable to attend the group because they knew the program and the facilitators. There were other services that they needed to access or were accessing in those programs already, and these projects were located in their community. Additionally, in Head Start projects, women spoke about feeling more connected to culture as a result of participating in connections, specifically a greater sense of belongingness to the connections group and their community, as well as more aware and accepting of traditional teachings. This slide summarizes the way in which we mirrored the theoretical frameworks from Breaking the Cycle, not only into the connections intervention and the certified training process, but also into the research and evaluation of community-based programs. We were very deliberate in identifying the levels of relationships that needed to be established and nurtured in this partnership, as well as the specific strategies that we used to ensure that we included safety and trauma-informed practice into these relationships. You can feel free to read more about it in the reference that we've cited here. So now I'm going to turn things back to Margaret to provide a little overview of our results.
Well, just some final themes coming out of our initiative and our research, just that for us to think about the importance of readiness to deliver a trauma-informed intervention, both readiness in communities, in projects, readiness of facilitators, and readiness of participants to participate in such a group. A focus on safety through trauma-informed and relational approaches is important in all aspects of the delivery of interventions. Important to remember the importance of fidelity, but while also respecting community wisdom. And finally, to recognize the strength of collaboration among CAPC, CPNP, and Head Start projects, and the capacity for them to disseminate an interpersonal violence intervention within the context of a community-based project. Thank you.
Thank you, Margaret and Mary. And I'm going to jump right into questions. The first one really relates to what you were just talking about, the importance of the readiness, and in particular, your tools. So you mentioned that there was an assessment in terms of, are the participants ready for this intervention, the community, the facilitators? How did you determine that? What does this tool contain? I think people are very interested in that.
Mm-hmm.
So we did, it is available. We did publish the tool, and so it's available in the reference that Margaret had on the slide. But it really did look at different aspects of safety. So whether that was internally with the programs, in having policies and procedures that would keep staff and families safe, looking at connections in community. So were there relationships with child welfare agencies, with women's shelters, with other services that families would require? Was there the physical space to be able to deliver the intervention, including a group room, childcare, snacks, but also a private space to speak with women if that was required? So we just tried to look at sort of all of those aspects that were going to keep families safe and to understand that they would be ready for the delivery of that intervention. Margaret, is there anything I've forgotten?
No, that's it.
Okay. Thank you. Another question relates to the community of practice. Obviously, that was a key piece of this Building Connections initiative. What do you think made it successful?
Well, maybe I'll start. It was linked to the training, so it sort of pulled some threads and continued the discussion and learning from the training. But I think what made it successful was that it was regular, it was scheduled, it was consistent. It happened every week from 1 to 2 p.m. Eastern Standard Time. Anyone could join when they were able to, and it was a standing consultation meeting that people felt that they were part of. I think over time, the success included the fact that the facilitators were able to share their own learnings and support each other in a way that they didn't at the beginning, but with their experience in delivering the intervention, it became a very mutual learning experience and they became a network of facilitators in CAPC CPNP projects of this intervention across the country. So those relationships strengthened among them.
And can you just expand a little more, perhaps, Mary, how would it have helped with fidelity? You mentioned that you think the community of practice was key in fidelity to this intervention. How? Why?
Well, I think it was really, the opportunity to just ensure that people had sort of common frameworks and common thoughts about the delivery of the intervention, but it also provided them a space to ask very specific questions about the evaluation. So if they were unsure about technical aspects of using the iPads with the groups, or couldn't remember which questionnaire to administer at this point, or so it just was that ongoing support, not only of relationships and safety and those frameworks, but also just technical aspects of delivering the research and the intervention that we were able to address, as Margaret said, on a regular, consistent basis.
And finally, just to wind up, you mentioned if people are interested, obviously we could see that you've been publishing, and that's wonderful. In terms of the manual and other things, where would people find, if they're not necessarily into academic journals, where will they find information about this amazing initiative?
Well, there is a Building Connections webpage on the Mothercraft website where all of the manuals are available, as well as additional information about our publications, our resources, as well as the national training webinar. Everything is on the Building Connections webpage at the Mothercraft website, mothercraft.ca.
Mothercraft.ca. Thank you, Mary. Thank you, Margaret. Connections, it's so aptly named when you look at all the connections that were involved in this project. Thank you both for sharing some of the amazing outcome from this project.
Thank you
so much, Linda.